Okay, today we will talk about a very interesting acute case. The case is interesting in terms of being a case of a little 1.5-year-old child, and interesting aspect of this case is that we have information from the mother of baby, and there are many things which is very important to note at our own end. There are many things which we can observe by seeing the video of case. Mother is giving lot many information which is of use to us, but beside that, what we are observing by seeing this video, by the activities of child, by the gesture of child, that something is equally important to us. And in homeopathy, this is equally important to note the gestures, expressions, activities of the patient at the time of case taking. And this gives many times a very important aspect for us to create a perfect totality. So video, as you have seen the video of this case, this is the case of acute fever. A baby had been suffering from fever from last night, and as mother told that there was nothing prior to fever. She had vomiting with fever, and then after fever she became restless, and she also lost her thirst. Otherwise she was drinking water normally, but since fever she is having thirst very less. Her activities, although she was very active, as mother says that she was very playful, wandering here and there, still if you watch the video, baby is still restless. This is this restlessness, this activity of baby is still more than usual. She is moving up, she is coming down, she is opening drawer, she is bringing object out, copies out, papers out. And one thing which you note is very important, that she is trying to tear things. She takes paper in her hand and she tries to tear it off. So the nature of baby is like that she picks the object and she tries to tear them. She is quite restless, hyperactive, moving here and there. And as mother says, and that can be seen by the video as well, that she feels better only when she is being carried. When mother carries her in lap, or she carries to her shoulders, then only baby feels a little comfortable. Otherwise most of the time baby is restless, moving here and there, making some noises. So lot many things are there which we need to observe, and we can make rubrics for all these possible conditions, and this can give us a very accurate totality in such acute cases. So we have a lot many things to see and understand, and on the basis of what we have seen, what mother gave information, we will make an acute totality, and then we will go for the selection of remedy. So in my opinion, the symptoms which are very important which should be considered for prescribing an acute remedies are fever coming with vomiting. Fever started from night, around middle of night, and then since fever she has become thirstless, she is restless, she has a tendency to tear things, she doesn't like covering. The mother told that baby is not willing to cover her body, and she feels better when she is being carried, when she is being taken to the shoulder. So this is the possible set of symptoms which create the or which cover the entire totality of acute state of this kind of condition. So we go to the repertorization, and we open the repertory and we try to find the possible rubrics. And we first go into mind. Restlessness, fever, during, or feverish. We have a rubric feverish. That simply means that restlessness is during fever, or we have a cross reference, heat during. This is a better rubric. Restlessness, heat during, and we take this into account. Restlessness, heat during. Another rubric can be baby, or we can take in general. The baby is very hyperactive, kind of moving here and there continuously. So restlessness, children in. This is another rubric. Mind, restlessness, children in. We take into consideration. We can also take another cross reference here is general energy access children, and this is the baby who is, as mother says, that she keep on moving here and there all the time, and we can take this rubric, general energy access children in, and this is also taken in. Then we have another important rubric which should be taken into consideration. As you seen in the video, baby has a tendency to tear things. So we go in tearing, and here is the rubric, things in general. Tearing, things in general. This is the rubric we again taken. Then as mother told, and you have seen in the video, that baby likes to be carried. So we take carrying, carried, desire to be carried. Here is the rubric, desire to be carried, and we take into consideration. And then another rubrics which are related to fever, that her fever started with vomiting. So we go into a stomach, vomiting, fever during, but we don't have any rubric for or any remedy for this. This rubric is still to be created, so we leave this rubric, or rather we try to search if there is any combination of fever and vomiting anywhere in the repertory, and yes, we have we have fever, vomiting type of. This is the rubric which can be taken into account. Fever, vomiting, type of bile, fever during. Although character is not explained by the lady, so it's quite confusing whether we should take this rubric or not, because the rubric which we want is exactly fever, vomiting with, which is not available, so it's better we leave it, we don't take it in consideration. Then she has become thirstless since fever, so we take rubric stomach, thirstless, fever during, and this is the rubric we find, stomach, thirstless, fever during, and we take in consideration. And another symptom which baby's mother told us, that she doesn't like covering at all. So we go into generals and we find the rubric covering, covers aggravate. She doesn't like to cover herself, and as soon as the mother tries to cover, she kicks it off. So we take this rubric, covers aggravate, and we take another rubric which is here, covers kicks off, doesn't like covering at all. So these are the set of rubrics which covers the entire acute totality of case, and we again review the rubrics, and here are the rubrics: mind, restlessness, heat during; mind, restlessness, children in; general energy, excess of energy, children in; mind, tearing, things in general; mind, carried, desire to be carried; stomach, thirstless, fever during; generals covers aggravate, general covers kicks off. So these are the rubrics which covers the entire totality of case. Another rubric which can be taken into consideration is that fever is started from middle of night. So we can take rubric in from chapter fever, night, midnight. This can also be taken into consideration. Night, midnight, after, and we can take this also as a rubric. So we have 9 rubrics now, and we see the analysis, and the remedies which are coming up are sulfur, phosphorus, rust tox, lycopodium, mercury, veratrum album, chamomilla, ignatia, opium, china, arsenicum. These are the remedies which are coming up. But my choice of remedy out of these all the remedies which I would prefer to take into consideration is that in my opinion this baby should be given, or else we must also look what Vitholkas says about this case. We go into Vitholkas, and according to him a case of veratrum or remedies can be veratrum, phosphorus, mercury, sulfur, medorinum and ignatia. Okay, this is what Vitholkas suggests. We again go back in the repertory sheet, and in my opinion the remedy should be veratrum. Why veratrum? Because veratrum patients are otherwise very thirsty, but they become thirstless during fever. They have a desire to be carried, they are quite restless, anxious, moving here and there, and moreover they are of very destructive nature. The babies of veratrum wants to tear things, can't stay at one place, moving here and there. So many times they behave like tarantula patients, as tarantula baby, that tearing things, moving here and there. So all this make me to think of veratrum album, and I prescribe 1 dose of veratrum album 200 for the baby, and after prescribing first dose we again called to the lady who came to me another day, and the results were quite impressive and appreciating for the baby as well as for the homeopathy. So I will show you the follow-up video which explains that baby recovered quite quickly, and she became more comfortable, more calm and quiet after the prescription of drug.